Last year, over $1.4 billion poured into AI tools that promise to save nurses. 77% of American hospitals are already running Microsoft DAX, and early test sites report a 70% drop in burnout. The medical world claims the AGI switchover can finally give nurses back their time. But behind these numbers, hidden risks are rising, and not everyone believes the human touch can be automated. If robots are replacing paperwork, what happens when they make mistakes? Here's what the early days of this transformation really mean for nurses and for every patient depending on them. Microsoft's $19.7 billion acquisition of Nuance set off a race among health systems to automate documentation at scale. Today, more than 3 out of every 4 hospitals in the United States rely on DAX Copilot, making it the most widely adopted AI platform in the sector. The numbers are staggering. In under 2 years, healthcare spending on documentation AI has surged, with industry analysts projecting billions in annual savings as these tools become standard across electronic health records. Studies from 2025 show that clinicians using ambient scribes cut their documentation time in half. In a survey of 879 providers, 7 out of 10 reported less burnout, and each patient interaction now takes 7 minutes less on average. For nurses, the shift is immediate. Instead of racing to update charts between patient visits, they speak their notes aloud and let the AI transcribe, summarize, and file everything in real time. At Baptist Health, early pilots saw documentation delays drop by 1/5, and overtime hours fall by nearly 1/3. Across the VA's 170 medical centers, the rollout of ambient AI is projected to save $500 million a year, money once lost to manual paperwork and after-hours charting. The transformation reaches the bedside. With Dragon Copilot for nurses, built alongside teams at Stanford, Duke, and NYU Langone, nursing-specific AI now handles the tedious record-keeping that once filled up entire shifts. A nurse finishing a 12-hour day describes the change. "I don't spend my breaks catching up on notes anymore. I actually get to talk to my patients." But as hospitals become dependent on these systems, the stakes get higher. The promise of reclaimed time and reduced burnout comes with a new reliance on software, and a growing question about who is in control when the paperwork disappears. Dragon Copilot for nurses arrived after months of collaboration with bedside teams from Stanford, Duke, and NYU Langone. The tool listens as nurses discuss symptoms, medications, and care plans, then drafts full notes for review, no more scribbling between alarms or charting late into the night. At Baptist Health, early results showed documentation latency cut by 21%. Overtime hours dropped by nearly 1/3. Nurses reported saving between 8 and 24 minutes per shift, time that once disappeared into paperwork now returned to patient care. One nurse finishing a 12-hour shift described the difference. "Before, I'd spend my lunch break typing up assessments. Now, I actually get to sit with a patient who's anxious or just wants to talk." The effect ripples out to the system. Across the VA's 170 medical centers, the rollout of ambient AI is projected to save $500 million each year. That is money once tied up in manual charting and after-hours corrections, now freed for staffing, supplies, and direct care. The shift is more than numbers. Nurses describe a sense of relief as the weight of documentation lifts. Instead of racing to finish notes, they find themselves present at the bedside, catching subtle changes in a patient's condition or offering comfort in a quiet moment. For the first time in years, some say, it feels like the job is about people again, not paperwork. But as these tools become woven into daily routines, trust grows, both in the AI's reliability and in the promise that technology can give time back to the human side of nursing. The next question, can these systems help predict and prevent emergencies before they happen? At Johns Hopkins Hospital, an AI system called TRUES quietly scans the electronic health records of every patient, searching for the earliest signs of sepsis, a deadly, fast-moving infection. TRUES analyzes vital signs, lab results, and clinician notes, often spotting trouble hours before human eyes would. When the system detects subtle patterns that signal danger, it sends an alert straight to the nurse's workstation. In these moments, the nurse's role is decisive. Acting on a TRUES alert, A nurse may order a blood culture or start antibiotics before symptoms fully surface. Across more than 500,000 patients, this approach has delivered a measurable impact. Hospitals using TRUES have seen in-hospital mortality from sepsis drop by nearly 19%. 90% of providers now rely on these early warnings, trusting the algorithm to flag cases they might otherwise miss. At UC San Diego, a similar story unfolds with the Composer system. Here, predictive AI combs through streams of patient data, alerting clinical teams to risk before a crisis hits. The results are clear: 17% fewer deaths among those flagged by the system. The eCart model, rolled out in hospitals across the country, pushes the lead time even further. With nearly 90% accuracy, eCart can warn staff up to 11 hours before a patient deteriorates. That window gives nurses and doctors the time to intervene, stabilize, and change outcomes that once seemed inevitable. These systems do not replace clinical judgment, they sharpen it. Nurses describe the relief of having a silent partner, always scanning for danger in the background. When an alert pops up, it is an extra set of eyes, not a command. The decision still rests with the nurse at the bedside, but now the odds are better. In the world of predictive AI, every minute counts, and for thousands of patients, those minutes have meant the difference between life and death. Moxie glides through hospital corridors, dodging rolling beds and bustling staff, its blue lights blinking as it ferries lab samples and medications from pharmacy to patient floors. In just a few years, these delivery robots have become a familiar sight in more than 20 health systems. At Children's Hospital Los Angeles, Moxie completed over 2,500 deliveries in 4 months, saving nurses 1,620 hours, time once lost to endless trips for supplies. In the VA network, tug robots now handle transport duties across 37 facilities, moving everything from blood draws to fresh linens. These machines don't just lighten the load, they free up nurses for care that cannot be automated. Logistics managers describe a quiet revolution behind the scenes. Tasks that once required a human runner, fetching IV pumps, restocking medication cabinets, delivering lab results, now happen on autopilot. Robots navigate elevators, swipe security badges, and log every trip. For nurses on the floor, the change is immediate: fewer interruptions, less back and forth, more time with patients. One charge nurse puts it simply: "I don't have to leave my unit to find a bag of saline. It arrives when I need it." Medication safety is shifting as well. At Massachusetts General, automated dispensing cabinets powered by AI prevent 4,500 adverse drug events each year. Robotic systems double-check orders, flag dosing errors, and cut medication mistakes by 40%. These safeguards run in the background, catching problems before they reach the bedside. Nurses still verify every dose, but the margin for error is shrinking. The scale of automation is growing fast. Moxie alone has logged more than 1 million deliveries nationwide. For every hour saved, a nurse can sit with a worried family, spot a subtle change in a patient, or simply take a breath. The hardware is no longer a novelty. It is woven into the fabric of daily care. And as robots and AI handle more of the routine, a new question rises. With so much work offloaded, why is the demand for nurses still soaring? Hospitals are racing to automate, but the numbers reveal a stubborn reality. The World Health Organization projects a global shortfall of 4.5 million nurses by 2030, with the largest gaps concentrated in regions least able to fill them. In the United States, the Bureau of Labor Statistics forecasts nearly 190,000 registered nurse openings every year through 2034, driven by retirements, burnout, and an aging population that needs more care, not less. Nursing schools are turning away tens of thousands of qualified applicants each year, unable to keep up with demand due to faculty shortages and limited training sites. Despite the surge of robots and AI scribes, only a fraction of nursing work can actually be automated. McKinsey's analysis puts the figure at just 10 to 15%, mostly routine documentation, basic vital signs, and supply runs. The rest of the job demands skills no algorithm can replicate: physical care, emotional support, clinical judgment, and the ability to spot the subtle changes that signal trouble. Even the most advanced AI cannot comfort a frightened patient, notice a shift in breathing, or advocate for a family in crisis. Yet the pressure to close the gap is relentless. Nearly 40% of registered nurses say they plan to leave the workforce within 5 years. At the same time, the demand for nurse practitioners is set to climb 52% by 2033, outpacing almost every other profession in healthcare. The paradox is clear: technology is accelerating, but the need for human nurses is growing even faster. Every new tool promises relief, but none can replace the core of the profession. For nurses weighing their future, the message is mixed. Automation is changing the shape of daily work, freeing up time and reducing paperwork, but the essential tasks remain stubbornly human. The result is a workforce stretched thin, asked to do more with less, while billion-dollar systems promise solutions that rarely touch the heart of the shortage. In this landscape, the rush to adopt new technology is not just about efficiency, it is about survival. Epic's sepsis prediction model was installed in hospitals serving more than half of all U.S. patients, promising to catch deadly infections early. But a review published in JAMA revealed a stark reality. The system's real-world accuracy dropped to just 63%, far below the company's own claims. In practice, Epic's algorithm missed 2 out of every 3 sepsis cases, while flagging nearly 1 in 5 hospitalized patients unnecessarily. The result was a flood of false alarms. Nurses and doctors, overwhelmed by constant alerts, began to tune them out. In some wards, more than 90% of warnings went ignored, eroding trust in the very tools meant to keep patients safe. The problems did not end there. IBM's Watson for Oncology, once the poster child for artificial intelligence in medicine, collapsed after a $4 billion investment. Watson was supposed to recommend personalized cancer treatments, but it was trained on synthetic cases, not real patient data. In Denmark, oncologists found Watson's advice matched their own only 1/3 of the time. In the United States, the system suggested unsafe chemotherapy for patients with clear contraindications. Hospitals quietly dropped the product, and IBM shut it down. Regulators have struggled to keep up. The FDA has cleared more than 1,250 medical AI devices, but 6% have already been recalled, many within the first year. Some failures never make headlines. Algorithms designed to allocate care for 200 million Americans have been shown to underestimate the needs of Black patients, amplifying health disparities. Pulse oximeters, widely used during the COVID pandemic, have been less accurate on darker skin, leaving Black patients 29% less likely to receive oxygen in time. Clinicians are wary. Nearly 60% of physicians say they dismiss AI alerts because the system gives no clinical rationale. As these tools multiply, so do the risks. Malpractice claims involving AI have risen by 14%. For nurses, the consequences are not abstract. When an algorithm fails, it is the patient in the next bed who suffers and the nurse who must answer for it. Dario Amodei, CEO of Anthropic, stood before a room of world leaders at Davos and made a prediction that sent shockwaves through the industry. He said, "We expect powerful AI systems in the next 2 to 3 years." Anthropic's official stance sharpened the timeline further, predicting powerful systems in late 2026 or early 2027, with capabilities matching Nobel Prize winners. Demis Hassabis, the leader of Google DeepMind, revised his own forecast, cutting it from a decade to just 3 to 5 years. He said there will be meaningful evidence of AGI in 2025. Sam Altman of OpenAI said they are now confident they know how to build AGI. But the warnings are just as stark. Geoffrey Hinton, often called the godfather of deep learning, estimates a 10 to 20% chance that advanced AI could lead to human extinction within the next 30 years. Academic surveys remain cautious, placing a 50% probability on true AGI by 2047. The gap between industry promises and scientific skepticism is widening, while the pace of development only accelerates. As deadlines shrink, the pressure to deploy untested systems in hospitals grows, raising the risk that the next leap forward could outpace the safeguards meant to keep patients safe. National Nurses United, with more than 225,000 members, draws a clear line. The hands-on work of caring cannot and should not be automated. For many on the front lines, the promise of AI is shadowed by deep skepticism. In a recent McKinsey survey, 61% of nurses voiced concerns about the accuracy of AI tools, and nearly half worried that technology would erode the human connection at the heart of their work. Only about a third of younger nurses feel hopeful that AI will improve care quality. Distrust runs even deeper among patients. 3 out of 4 say they do not trust AI in healthcare settings, and 63% fear that new systems will mean less time with clinicians. In a 2024 study of over 1,000 patients, trust, satisfaction, and adherence to treatment all ranked higher when care was delivered by a human, not an algorithm. Psychiatry patients in particular reported a sharp drop in trust when AI entered the room. The difference comes down to something no machine can replicate. Decades of research confirm that touch, whether a reassuring hand or a gentle presence, engenders sympathy and a sense of safety. Nurses notice cues that algorithms cannot see: a clenched fist, a trembling voice, a moment of hesitation. As one union representative puts it, there can be no substitute for the expressive touch of a nurse. The question now is not whether AI can help, but who decides when the line between support and replacement is crossed. Today, every major hospital runs on AI, yet the world faces a nursing shortage of 4.5 million. As algorithms grow smarter, the limits of automation become clear. Only 10% of nursing tasks can be replaced by machines. Patient safety, dignity, and empathy remain human responsibilities. The future of care hinges not on code, but on trust, earned, not programmed. What would you trust with your life? Let us know below.